Good morning, students. Today we will be covering the topic of anatomical pulleys. Now, if you understand, pulley is a simple machine that consists of a wheel that turns around an axle. This wheel is usually grooved for a rope or a wire cable. Now you can see this image, you can see there is a wheel which has been grooved, and in the center there is an axle, as well as there is a rope which is present inside the groove. Now whenever we study or we hear this word pulley, this image come up to us. You can see there is a wheel and we are about to lift the bucket from the well, where an effort is done with the help of arms, and where the load is the bucket full of water. Fine. Now there are basically three types of pulley: a single fixed pulley, a single movable pulley, and a pulley combination. Now a single fixed pulley aims to change the direction of force acting on it, but its magnitude remains the same on either side of the pulley rope, irrespective of to the angle of pull of the force. So its mechanical advantage is only one. So a single fixed pulley is only changes the direction of force. It doesn't change the magnitude of force on the either side of the pulley rope. Therefore, the mechanical advantage is only one. A single movable pulley acts as a second class lever. Its mechanical advantage is two, because it changes the direction of force as well as it magnifies the force. It magnifies the force, therefore it has more advantage. Now, pulley combination is the third, where there is a combination of simple as well as a single fixed and single movable pulleys, which we use in suspension frames. So if we see this image, you'll come to the types of pulley system. The first is the fixed pulley system, where you can see the one side is the effort and the other side is the resistance. This in the second pulley, the fulcrum is fixed, and you can see the wheel and the axle is attached towards the load, and the effort is done on the other direction. See that there's a change in the direction in cases of fixed as well as in the cases of movable pulley. Wherein in the compound pulley, you can see that there is example of single fixed and single movable one. And the last one which we use in suspension, we use both compound and block tackle for our suspensions. Fine. Now, this was just giving you an idea about pulley. Now we have to do the topic called anatomical pulleys. In human body, in most cases, the pulleys is replaced by bone, cartilage or ligament, and the cord is replaced by muscle tendon. The tendon is lubricated in a manner that it may easily slide over the pulley. Now this was a mechanical part in our human body. Now pulley can be a bone, it can be a cartilage, it can be a ligament, and the rope is the tendon. Fine. Now there are four classes of pulley. In the first three classes are example of fixed pulley, and the fourth example is of a movable pulley. Fine. Now let us see the class 1. An improved muscle action comes from the muscle tendon passing over an external support. The external support serves as a pulley. That means class 1 pulley basically is used to improve the muscle action, as muscle passes over an external support which basically act as a pulley. Example can be the presence of patella, which is an external support which is acting as a pulley. It improves the efficiency of quadriceps muscle, as pulley will increase the angle of insertion of the patella ligament into the tibial tuberosity. With this image, you can see the quadriceps muscle, the quadriceps tendon, the patella and the patellar tendon, and how you can see it is acting as the patella is acting as pulley. The effort is lifting or extending the knee, and the effort has been done by the quadriceps muscle. The load is the lifting up of the load, that is extending the knee, lifting up the leg, and the effort has been done by the quadriceps muscle, whereas the pulley is basically here, it is changing the direction of muscle and it is improving the action of muscle. Fine. Class 2. Now it is responsible for altering the action of a muscle at a joint, or the action of the muscle at a joint is altered because of the pulley. Now the pulley is a bone here. The lateral malleolus of the fibula act as a pulley for the peroneus longus muscle. If it was not for the malleolus, this muscle, instead of passing behind the lateral malleolus to be inserted in the base of the fifth metatarsal and to produce ankle plantar flexion and eversion, it would have produced ankle dorsiflexion and eversion because of its passage in front of the ankle joint. Now with this image it will be more clear. If you can see, this is peroneus longus tendon which is passing through the lateral malleolus and then it is inserting at the base of the fifth metatarsal. Now because of this insertion or because of this lateral malleolus, can you see the angle at which it is getting inserted? Because of this, the function is plantar flexion and eversion is possible. Now if it is not passing through the lateral malleolus, then this peroneus longus muscle will pass from the front of the ankle. When it is passing from the front of the ankle, it may result in what? Dorsiflexion and eversion. Therefore, it is a very good example of a second class pulley where this lateral malleolus is acting as a pulley and altering the action of the muscle. Fine. There can be another example. The pulley is a cartilage. Now the trochlea of the eye allows the superior oblique muscles of the eye, when it passes over it, to rotate the eye obliquely. Without this pulley, the muscle would have little effect on the eye. Now if you see, this is the image of eye and you can see this is the lateral rectus muscle which is responsible for lateral rotation of the eyeball. Herein you see this is basically for the superior oblique. This is superior rectus muscle, this is inferior rectus muscle. Now see this insertion, this is acting at an angle to the eyeball, and this angle here, it is holded by the trochlear fibrocartilage. This angle which is given, it is done by the trochlear fibrocartilage, and that is the reason why otherwise superior rectus will only roll the eye upwards, whereas superior oblique is making this movement as intorsion movement, that is adduction and downward inward rotation of the eyeball. Intorsion movement of the eyeball is done by superior oblique. Can you see how it is getting inserted? This inferior oblique is also getting inserted. Superior and inferior oblique is a typical example of the trochlea acting as a pulley. The third is pulley is a ligament. The flexor retinaculum of the hand act as a pulley for the flexors of the finger to prevent its bowstring. Without this action, these muscles will not be effective in moving these joints. Now we do remember that flexor retinaculum of the hand is extended into flexor sheath, wherein the flexors, the flexor digitorum superficialis and flexor digitorum profundus gets inserted into the middle phalanx as well as the distal phalanx. Fine. Now if we see this image, it will be more clear. Since the FDS and FDP are passing through multiple joint, so what is the chances here is that they may impinge, these tendons may impinge or they may be caught in between these joints. Can you see? They are crossing one joint, second joint, they are about to cross the third joint also, and they are coming from the wrist. That means they are already covering the wrist joint. So here their chances are there that they may get impinged when the movement like this is taking place. Okay? When this kind of a movement is taking place, the chances that they can be impinged. So to protect these tendons, the flexor sheath, there is on the flexor sheath, you can see there is a transverse kind of a covering. This is called as the annular pulley. This annular pulleys which are at the head of the MCP, at the body of the proximal phalanx, at the head of the proximal phalanx, at the body of the middle phalanx, at the head of the middle phalanx. There are 5 annular pulleys are there, therefore, which are trying to protect and which are trying to giving protection and giving space and holding these tendons at its position. There are another kind of pulleys are also there, which are called as cruciate pulleys, which are basically in between the joints. Can you see in between the joints there are chances of their popping up. So what happens is that this cross structures are the cruciate pulleys, and they are responsible for prevention of bow stringing. Bow stringing is popping up. If this is not there, this tendon, the blue tendon, will pop up, and then the muscle will not be able to produce the function of, that is, the BIP joint flexion. This not be produced. Why so? Because the muscle length has been shortened. So these both pulleys are very much important for the action of FDP and FDS. So the in second class pulley, the action of the muscle at the joint is altered. It can be either the pulley can be a bone, the pulley can be a cartilage, and we have seen the pulley can be a flexor retinaculum. Fine, a retinaculum can be there. So for a bone, we took an example of lateral malleolus and the action of peroneus longus muscle. For a cartilage, we took an example of superior oblique muscle where the trochlea was acting as a fibrocartilage. And for a ligament, we took an example of flexor retinaculum of the hand for the FDP and FDS function. Fine. And these are the two images which make it further clear. Now coming to the third class pulley, herein the joint serves as a pulley. The size, giving you an example, the size of the epicondyles of the femur gives the gracilis tendon a favorable angle of insertion as the tendon gets inserted into the tibia. Now herein, I want to show you this image. Now here, it is the gracilis tendon is getting originated from the pubis symphysis, and can you see it is running down and getting just passing through the medial epicondyle of the femur, and then getting a favorable point inserting into the tibia, inserting at a point near the tibia. So this joint, knee joint, is basically, it is crossing the knee joint. The epicondyle of the femur is acting as a pulley over here. This joint is serving as this part, medial epicondyle, is acting as a pulley over here for the effective action of gracilis tendon and its insertion on the tibia. Fine. Another example is the middle part of the deltoid as it passes over the shoulder. This we have all seen. You know that the deltoid muscle has got interior, middle and posterior fibers, and it passes like it covers the whole shoulder joint. So it is passing through the head of the humerus, it is passing through the shoulder joint and then getting inserted in the tuberosity. So we can see that the deltoid muscle, the middle deltoid, is passing over from the joint. Herein shoulder joint is acting as a pulley. Now there is class 4 pulleys also. Now the muscle acts as a pulley. The muscle is its own pulley. That is, biceps muscle increases in size and its angle of insertion will increase. The muscle underneath acts as a pulley for another muscle which passes over it. That is, brachialis muscle will raise the biceps, giving it a better angle of insertion. For this to be effective, the overriding muscle must not have the same insertion as the bulky muscle. Now, if we can see this diagram, you see the muscle, biceps muscle, has increased its size. The bulk of the bicep muscle is more. Now, if the bulk of this bicep muscle is more, you will see that it has got this distance from the point of insertion. So therefore, the perpendicular distance is more from the joint and it can lift more amount of weight. It can also happen if the brachialis muscle has increased in its bulk. So it will allow that the biceps insertion, the distance will further increase for the biceps tendon. So both this condition, here the muscle is acting as a pulley for another muscle, or muscle is acting as a pulley for itself. The increase in the bulk of the muscle helps to increase the movement or the effort arm or the perpendicular distance from the joint, and thus the efficiency of the muscle increases. Fine. Now, with this wheel, with this pulley, I want to touch this topic also because it is very much important. Wheel and axle, because since we are studying simple machines and we studied about lever, then we studied about the pulleys. Now we are studying about wheel and axle and how they are applicable in our human body. Now, it is a machine that consists of wheel that is attached to a central axle about which it revolves. Forces may be applied to the wheel either at the rim or at the axle. The center of the wheel and the axle both correspond to the fulcrum, and both the radius of the wheel and the radius of the axle correspond to the force arm. Now this will be more clear. This is the wheel and this is the axle. The center of the axle and the center of the wheel acts at the fulcrum. This is the force applying at the rim, and the effort load is being applied at the axle. This is the distance. R is the distance from the center point, that is fulcrum. R is the distance of the wheel, and small r is the distance of the axle, the distance of the axis and the axle. Now here the force, can you see, the force is applied at the rim of the wheel and the load is applied at the axle. Fine, that is, this is. Now if the wheel radius is greater than the radius of the axle, then due to the longer force arm, the wheel has a mechanical advantage of the axle, because you understand the R, capital R, is greater than the small r, that is the radius of the axle. This will give a longer force arm, and when there is a longer force arm, then what will happen is it will be a mechanical advantage. The wheel will have a mechanical advantage over the axle. That means a smaller force may be applied to a wheel to move a relatively greater resistance applied at the axle. We will require a very small force to overcome the resistance applied at the axle or the load applied at the axle. Now, if the radius of the wheel is 5 centimeter and 5 times the radius of the axle, then the wheel will have 5:1 mechanical advantage over the axle, as simple as it can be. Okay? So how do we calculate the mechanical advantage of wheel and axle is by considering the radius of the wheel over the radius of the axle. Fine. Now, before we do this example, let us understand the second part also. If application of force is reversed and applied to the axle, then the mechanical advantage results from the wheel turning a greater distance and speed. Now, if what does this condition say? Now the force is applied at the axle and the load has been lifted by the wheel. The thing has been reversed. Now the application of force is applied at the axle and the load is being applied at the rim of the wheel. So what will happen is that the wheel will have a mechanical, this will result in the mechanical advantage results from wheel turning a greater distance. Wheel has to go for a greater distance and greater speed. If the radius of the wheel is 5 times the radius of the axle in this condition, then the outside of the wheel will turn at a speed 5 times than that of the axle. That means when I'm moving the axle one circle, the wheel will move 5 times. The wheel will move 5 times. That means the displacement of the wheel will be more and the speed of the distance covered and the speed will be greater. The amount of effort which will be done by the axle will be only small, whereas at the wheel it will be 5 times more. So the distance that the outside of the wheel turns will be 5 times than the distance outside the axle. Axle में 1 circle होगा तो outside wheel में 5 circles हम cover करेंगे. Fine. Now if we see this example, consider in human body, humerus as an axle and the forearm and hand as a wheel. Now if this is the condition, you can see it is a short lever arm. Take it as a short lever arm. Don't take it as a with elbow extension. You take it as a condition in which elbow is being flexed. Now you want to see that you are using the rotator cuff muscles and rotate your humerus inward. Now as you move your humerus inward, you see that the forearm is moving a greater arc of movement is taking place, a greater displacement is taking place. The movement at the humerus is very small, whereas the hand is traveling a large amount. A little effort of humerus results in a significant amount of movement at the hand. So herein you can understand the load and the movement is small at the humerus, but the movement increases at the hand. Fine. So this is again the condition. In first condition, the load was being applied to the rim of the axle, rim of the wheel, and the effort was applied by the rim of the wheel, and the load was being applied to the axle. This is in the first condition, wherein the radius and is small r for the axle and capital R for the wheel. You can see for this the amount of effort, very small amount of load, there is very small amount of load is been applied, and the effort will be applied, or the effort or the will be applied through a larger radius, that is by the wheel. Now if we want to calculate the mechanical advantage in the second case, considering the radius and in which the load is been applied at the axle and the effort is been applied at the rim of the wheel, then we will say that mechanical advantage will be radius of the axle is upon radius of the wheel. Fine. That means in a simple way, axle will have to cover small distance, and it can cover in small distance large load. Okay? Herein advantage is at the wheel large distance can be covered with small effort. So herein more effort but small distance, herein large distance and small effort. Fine. Now wheel and axle are also divided into classes. In class 1, the force is applied at the rim. So it resembles the second class lever, and it magnifies the force at the expense of speed and distance. So it has a mechanical advantage 1. So when the force has been applied at the rim, so what is happening is that is less amount of effort is required, as we have seen over here. As we have seen, less amount of effort is required and larger distance can be covered. So it is a classical example of the second class lever where you can magnify the force, okay, but it at the expense of speed and distance. So the larger is the diameter of the wheel, the greater is the amount of force. The turning effect of the wheel is a product of force and the radius. In the class, the resistance is applied to the axle. In this class, the resistance is applied to close to the axle. Now in class 2, wheel and axle example, there is the effort has been applied to the axle and the resistance is applied to the rim of the wheel. It resembles the third class lever and its mechanical advantage is less than 1. This class will basically favor speed and range of motion at expense of force. So most of the example of wheel and axle in the body are second class. However, both kinds are present. Now let us see this. If you can see this diagram, you see this, that the person is going for, it's about to throw this ball. Now he is about to throw this ball, and if he wants to throw this ball, so what he is trying to do at the level of shoulder, the shoulder or the humerus is acting as an axle and the forearm is and hand is acting as a wheel. You see a small amount of external rotation is responsible for hitting the or large amount of movement at the wrist and hand. Fine. The other examples, when taking a cross section of upper trunk, the rib cage represents the wheel and the spinal column represents the axle. In class 1, wheel and axle, the oblique abdominis muscle exert their force on the rim of the wheel, that is the ribs, and the small rotators of the vertebral column, that is multifidus, it provides the resistance to the axle, that is vertebral column, during the rotation of rib cage. During the rotation of rib cage. So when we are about to rotate, you can see when you are about to rotate in the rotation of rib cage, you see that there is the axle is the vertebral column, and the multifidus muscle is applying the force on it, and the wheel is the rib cage, and the work is being done by the abdominis muscle in cases of rotation. If I can show you. Okay. The second is the class of wheel and axle is the effort has been applied by the small rotators of the spine to the axle, and the resistance is provided by the thoracic cage. Fine. Also, a cross section of the arm and thigh presents the characteristics of wheel and axle. The long bone will be the axle, and the surrounding tissue will be the wheel. Rotation of a limb around its mechanical axis constitutes the movement of the wheel and axle, with the effort being provided by the muscle producing the rotation and the resistance by the antagonist muscles. External resistance. In this arrangement, the resistance is applied to the axle from the same direction like the effort. So any cross-sectional area of arm and thigh is acting as a wheel and axle. So you can see for this, you can take an example of spinal cord and the rib cage, or you can take an example of any bone which is arm and thigh, which are acting as a the long bone is acting as a acting as a axle, and the movement is the wheel itself. Now there is higher order thinking skills. A wheel and axle is used to raise a weight of 240 kg. The radius of the wheel is 50 centimeter and the axle is 10 centimeter. When a force of 75 kg is applied to the wheel, the weight is raised with a uniform velocity. Fine. Find the mechanical advantage and the velocity ratio. Now, herein you see that the weight has been applied, the force has been applied at the wheel. So, herein you will have a mechanical advantage. What is mechanical advantage? You have load, you have effort, you have R, capital R and small r. So, you know that mechanical advantage is load over effort. The load was 240 kg and the effort is 45 kg. 3.2 is the mechanical advantage. What is the velocity ratio? The velocity ratio is, if you understand, velocity can be noted by, if you see the distance covered, we will be able to do that. 2 pi r. 2 pi r capital R, 2 pi r small r. So 2 pi is cancelled, r by r, 50 and 10. 5 is the velocity ratio between the movement of the wheel and the axle. Fine. I think this topic, I tried to cover this topic, and I think it is clear. If you have any doubts, we will continue this in our further classes. Thank you.